Okay, but let me know, sir, once it gets recorded. Okay, it's getting recorded. Thank you. Okay, welcome all. Good evening. Today, I have the privilege of the co-host to invite all of you for this session. We have a wonderful panel today, which we'll introduce in a bit of time, but a quick intro of the panel. Dr. Sarma Rajakonda, a medical practitioner, an academician, and a social worker, and a spiritual leader. One of the finest doctors in the country. He's the main panelist today. He specializes in multiple medicine and various other disease management specialties. We also have Sri Ravi Prakash Koti, doctor, MTech and PhD in computer sciences from IIT Madras, postdoctoral Carnegie Mellon University, USA. He's an academician with more than 35 years of experience and currently working in Emeritus as a professor of computer sciences and also at LNM IIT in Jaipur. I also have the privilege of introducing Sri Ramanamurthy Garu, retired DGM of Indian Overseas Bank, with 40 years of wealth of experience and served in different parts of India and currently staying in Odisha, Rayagada. That's quickly about the panel we have. A quick admin instruction to all participants. This is a webinar. Any questions that you may have, any help you need, there is a chat and Q&A icon that you could use, and you can post your questions. All questions are moderated, so you'll have to type your questions at the end of the sessions for the speakers. We will have, from that announcement, we'll have now Sri SVR Murthy Garu to start the session with a prayer.
Hari Om. Om Asyato Mam Sadgamaya Tamaso Mam Jyotirgamaya Mrityor Mam Amritam Gamaya. Om Shanti Shanti Shanti. I'll now chant beside the prayer Gurudev Rabindranath Tagore has written. Where the mind is without fear, where the head is held high, where knowledge is free, where the world is not broken up into fragments by normal domestic wax, where tireless striving stretches its arm towards perfection, where words come out from the clear depth of truth, where the stream of reason has not lost its way into dreary desert sand of dead habits, where the mind is led forward by thee into ever-widening thought and action, into that heaven of freedom. My Father, let my country awake. Om Shanti Shanti Shanti. Thank you.
I now request Dr. Koti Ravi Prakash, sir, to start the introductions of the panelists. Thank you, Dr. SVR Murthy.
Thank you.
Hi, a very good evening and hearty welcome to all participants from all around India. Perhaps there are a few participants from abroad too. COVID-19 has brought the whole world to a standstill like nothing before. People are saying that it wasn't like this even during the World War I and World War II. COVID-19 has affected all sections of our society in all parts of this world. It's more than 4 months by now, and we are still awaiting for the numbers to come down. Some medicines, very effective medicines to be available, etc. So it's very appropriate that we have a general knowledge session. And Dr. Rajkan Sharma, with immense experience in the fields of medicine for over 45 years, has kindly agreed to educate us about COVID-19. It's my privilege to introduce Dr. Rajkan Sharma now. He has over 45 years of experience post-MBBS and more than 42 years of experience post-MD in the fields of internal medicine, cardio, metabolic and chest diseases, infectious diseases, postgraduate medical teaching, medical research, and critical appraisal of medical literature. He has got quite a few fellowships. It's our privilege really to know. Fellow of Royal College of Physicians, Edinburgh, UK in 2016. Fellow of the American College of Physicians in the year 2013. Fellow of American College of Chest Physicians in the year 2012. Fellow of the Royal College of Physicians and Surgeons, Glasgow, 2011. MSc in Medical Research from McMaster University, Canada in 1984. He has quite a few national and international recognitions. At national level, he has got Fellow of the Indian Medical Association Academy of Medical Specialists in November 2016. Fellow of Indian College of Physicians in the year 2013. Fellow of the International Medical Sciences Academy in 2012. Life member of professional bodies like Indian Medical Association, API, Diabetes Association, etc. He has done innumerable teaching assignments to some of those very prestigious ones. Online faculty for MRCP students, Texila, American University, adjunct professor, visiting professor, emeritus professor at Rajiv Gandhi Institute of Medical Sciences, and similar ones. He has been a visiting professor at some of the prestigious institutions. He has got quite a few awards. Authored chapter algorithmic approach for diagnosing of polyuria in a textbook, several publications, orations, guest lectures, several national and international fellowships, etc. Without it takes a long time to really introduce him formally. It's my privilege. He has risen to the need of the hour to deliver a talk and educate us on something that's really bothering all sections of our society. Believe me, it is more than 4 months of not a normal life. So I request Dr. Sarma Rajkunda to educate us. Over to you, Dr. Sarma Rajkunda.
Thank you very much, Dr. Ravi Prakash, for a wonderful evening. We are all meeting here, and a nice introduction by you. And I'm thankful to you for the kind words that you have spoken. Mukesh sir, would you please put off your video? The thing is here, we are here for the COVID, which is, as has been pointed out, it's a very, very sort of thing that is there in all of our minds now. Now, the very purpose of this particular talk is to allay the fear and also to make us prepared for what we have to do for taking up this onslaught by the virus. So we have a lot of knowledge about COVID, all of you here who are watching, and I'm sure all this knowledge is from the lay press, for most of you are from the WhatsApp. So what one fundamental thing that we need to do is to unlearn most of the things that we have seen. Because what you see in the WhatsApp or in the lay press is unfiltered information, unscientific information. I would show you here in the presentation during the course of my talk what will be the valid and internationally acclaimed, peer-reviewed and scientific ways of knowing the information. It is important in this world of information sciences, you have to be kept informed, but not wrongly informed. So how do I go about that? That is exactly the presentation which we are going to do it. And again, I start all the talks with a simple word, idam na mama. Even this is not mine. This is made by the Almighty possible, and by all the people, without the help of all the persons around, we will not be able to achieve it. Idam na mama, this is not mine. I will just share the screen, and keep watching the screen very carefully. And I require your rapturous attention. And if you have any doubts, as has been pointed out, please type it out in the chat box. We will try to look at them at the end. Now I'm sharing my screen. So needless to have the screen, already this has been introduced to you. Most important thing is we have to live up to the expectation. COVID-19, essential basic knowledge. I am reachable at this number on WhatsApp as well as on text messages and call also. This is the website where you can find the details about the academic and other publications, other presentations that are made there. So please use that. This is updated till today. And as I told you earlier, the purpose is to allay fear and to prepare every one of us for action in case it is needed. So we go like this: the virus, the burden, the transmission, the prevention, the symptoms, the test and triage, the preparedness, the treatment very briefly, not in detail, the exercises that we need to do, some myths and facts, and the instilling hope and removing fear, and finally the 7 commandments that we will see at the end. See here, this is the COVID virus, very artistic, very good looking on the screen with multiple colors. But what are these things? You see membrane proteins, you see nucleocapsid proteins, the envelope proteins, the RNA, the heart of the virus, and the spike proteins. Why are we interested to know them? To these only we develop the test. And picking up these things is to pick up the virus. Any one or more of those things. So our tests are directed against these things. And also these are responsible for us to do research on vaccines and also on the drug trials to attack the virus to any one of the proteins or to prevent the virus to develop antibodies to one of these proteins. That is the main reason I brought this slide. You can see here there is a name given for this virus. It is called SARS, SARS-CoV-2. And the disease is called COVID-19. You may ask me why 2. We generally in medical literature, for the offending agent or the organism or the bacterium, we have a name. For example, HIV is the name of the virus and AIDS is the disease. Here it is COVID, SARS-CoV-2 is the virus and COVID-19 is the disease we have. If we are talking about the disease, we should say COVID-19. If we are talking about the virus, we have to say SARS-CoV-2. So 2 important terms you need to understand very clearly. You say somebody is quarantined, somebody is isolated. Many of us have a lot of confusion. What is quarantine and what is isolation? I would like to very clearly bring out the difference between them. If somebody is very healthy, does not have any disease, no symptoms, not tested, but had an exposure to somebody who is positive for the disease, such a person is kept under observation. That is called quarantine. Let us say in somebody's home there is a COVID positive patient. All the members are kept under quarantine. How long? Presently 14 days is the recommended period. Then what is isolation? If somebody is symptomatic and tested positive, he is already a patient and he will be transmitting the disease. We would like to keep the patient away from the healthy people. That is what is called isolation. How long we need to isolate? We were telling 14, but today there is a report by CDC Atlanta that 10 days would be adequate. CDC is Communicable Disease Center Atlanta. If they are having a milder illness, 10 days may be adequate to isolate. 14 days for normal individuals, not positive, no symptoms, but had a contact with a COVID person. To observe them, we keep them under quarantine. Where do we keep? Either at home or in the government facility called the CCC. What is that? We will see, Cavid Care Centre. Isolation again is for people who are tested positive and the persons who are in contact with them have to be really isolated from this particular patient. That's why this person is kept in a separate facility called isolation facility. It could be home isolation, it could be in the government facility or other hospital also. we'll come to that. What is case fatality rate? Case fatality rate means the fatality that we have whenever there are total number of fatalities that occur in with the disease, and then divided by the number of cases that are there. So number of deaths by the number of cases. But we don't know all the cases now. A lot of people are asymptomatic. A lot of people may not get tested. So the case fatality rate is always an overestimate. So what we have to look at is infection fatality rate. Those who are asymptomatic and those who are rather infected or symptomatic, they are all the people who are on the top, and the population is the denominator. Infection fatality rate, number of people who died is the numerator. Denominator is the number of people infected. Hospital fatality rate means number of people admitted to a hospital. Let's say there are 100 or 200. Out of them, how many people have died? That is what is called the hospital fatality rate. Let us not worry about the fatality rates. Most important thing is we need to remember that is quite low compared to other countries. Now, these are very important international recognized websites like ICMR, Indian Council of Medical Research, Ministry of Health, Family Welfare, and then WHO, COVID-19 WHO International Dashboard, Worldometers, NDTV, and a medical website called the e-medicine. You can get a very authentic and then peer-reviewed and current information on these websites. If you have any doubt, go to these things. I'm going to share the presentation as a video, and you can go to the YouTube and browse and see the video and get these links. Otherwise also they are available on the link. I'm not going to click them now. Just let us see the presentation first. Then if necessary, we go and click them and get into the dashboard. Now, this slide is very important for you to know that there are two methods that are commonly doing rounds in all your minds. Is it an aerosol or is it a droplet? What is the difference? A droplet is a very smaller particle of less than 5 microns. Because if it's smaller, it is a larger particle. Droplet is a larger particle of more than 5 microns compared to an aerosol, which is a smaller particle. Because of the largeness of the particle of more than 5 microns, it drops there. It does not go farther, and the distance it can travel is short. A larger particle travels shorter distance, less than 6 feet. That is why we say you have a distance of about 6 feet or 2 meters. Currently, this is the accepted method of transmission of COVID. And in certain situations in hospitals, when they do procedures like bronchoscopies or some endoscopies, aerosol can be generated, but that is not in the community. So there are 30 different research papers submitted to WHO. They had a meeting 10 days ago and finally resolved that aerosol is not the present mode of transmission. Aerosol is particle size is very small, less than 5, unlike here, and then the distance it can travel is up to 20 feet or around 7 meters. So this is a situation, but we are not with the aerosol as of now, and then we are with the droplet. What we have to do? We have to ventilate our rooms very well. When the fresh air comes in, the amount of the virus particles there in the room, they get diluted once you have the fresh air coming in. So ventilate your rooms. So I'm showing some slides very quickly how we can prevent the infection. First of all, cover your cough and sneeze with a tissue. Normally, we Indians have the habit of coughing into the hands like this. Please don't do that. Or we have the habit of focusing the cough onto the other person. Absolutely wrong. We should not do that. We must have a handkerchief with us, always available, a clean handkerchief. Cover the nose and mouth and then cough into that. Perfectly cover and cough into that. Keep it safe and then don't contaminate the cough. Fold that. And then keep it aside for use. If you are using a disposable tissue, you throw it in the trash. And supposing I don't have a kerchief or anything readily available, I get an imminent cough, what do? Cough into the elbow. Either better to be on the left elbow. Preferably, we don't normally touch this area and the shirt will be removed once I go home. So coughing into the elbow is the cough etiquette. This is called cough etiquette. All of us should know. By this, not only COVID, we prevent several droplet related and cough related diseases. We should not unnecessarily, like children, touch nose and mouth. Where is the business to touch mouth and nose normally? Unless when we are eating or washing, we have no business to touch the eyes and mouth and nose. Because this is through them. The hands are, we don't know, they may not be clean. If we touch the face unknowingly, it can contribute to infection. Then you can also prevent respiratory infections by avoiding close contact with people who are sick, not touching the eyes. I already told you, social distancing of at least 2 meters, at least 1 meter. If this is a patient, 2 meters. If non-patient, at least 1 meter you stand and speak. That is courtesy, isn't it? We can't be pouncing on people when we are talking. We have to keep a distance from persons, and it is a culture also to stay away for about 1 meter and then speak. Wash the hands often with soap and water for about 20 seconds. I will show you how to wash the hands. So look here, this is the child here, and the child is having, so I am putting my hands here. You can also view my video. Those of you are able to view the video. So you took the soap there, rub both the hands very well with the soap, then rub on the back of the hands like this, and then in the interspaces of the fingers, and cross the other side. Both sides I have done. Then I have rubbed on the upper surface of the hands. Then on the wrist area I have done that. Then on the palm of the hand I rub it on both the palms. Then I rub these thumbs also. So that is the perfect way of rubbing the hands. And it should take how long? As long as I have shown you. 20 seconds minimum, the soap should be in contact with the hand. How the soap kills the virus? Soap has got a sort of lipophilic facility, so it attracts the lipid, and this particular virus or most of the bacteria, they are lipid coated. So they get dissolved with the soap and flushed out. If you use plain water, they are not soluble in the water. So they cannot really wash the virus or bacterium out. That is the reason we use a soap. Which soap, you don't ask me. Any good quality soap will do the same thing. It is your preference. Now, supposing I don't have a sort of this one, I use a sanitizer like this. You know, this is a alcohol-based sanitizer, and then I'll put this into my hand like this, and then I will rub it first very thoroughly, and then on the back of my fingers, and also on the thumb, and on the like that, and then on the inner surfaces of the palms, and every area of the hand, back, front, in between the fingers, in the hand. Take around 20 seconds to rub it and then dry it. Total duration should be 20 seconds. Once the hands are dry, they're not infectious. How long? As long as you are not contaminating them, they will be good enough for another 1 to 2 hours. So what you have to do? We have to wash the hands when before meals. How many times we take the meal? 3 times. When we sneeze or cough, we have to wash. When we visit the toilet, or when we touch the pet, or when we play or come in contact with any produce that we get it from the market. So this means almost around 10 to 12 times you will be washing your hands. Remaining times keep sanitizing with your hand rub. So this is another type of hand rub is available. This is what is called the thick type of thing. Supposing you are going out, you may not be able to take a big bottle of alcohol based. Instead, you carry this and put a few drops of that in your hand and do the same thing. Okay? Like this, you have to do it. Why I am demonstrating to all of you? Most of us will just put our hand under the water, that's it, and then go. We don't spend enough time for the bacteria or the viruses to be killed. So unless you spend enough time with the hand washing and hand rubbing, the very purpose of doing that is lost.
You know that the best way to
just
prevent
skipping the video. Stop the spread of the germs, avoid close contact with people who are sick. Okay. Clean and disinfect frequently touched objects. What is the most frequently touched object? This is the one, the mobile phone. Mobile phone is the culprit here. Every one of us will be touching the mobile phone at least around 100 times the minimum in a day. So what you have to do? You have to sanitize the mobile phone using the not alcohol-based sanitizer. There are mobile phone cleaners. You have to use it and then sanitize. The other thing is laptops, tabletops, and then hand phones, sofas, chair handles, and then your keychains, kitchen dryers, any supplies that come in. All these things have to be disinfected. And we'll come to how to disinfect the packets and all at the end of the presentation. And most important thing is stay home when you are healthy and stay home enough when you are sick too, unless you have the severe emergency to go to the hospital. Home isolation, home quarantine, home stay, home working is the watchword. Now, how to wear the mask? There are two types of masks that are available. One is called the non-medical mask, which is a fabric mask like this. It will be inside, it will be clean white, and outside you can have any fancy design. You can stitch it up. Ladies will have nice flowers also outside, or you can match it with your blouse or whatever saree, no problem. But only thing is you have to touch the mask only at the sort of the elastic, put it on this one and then cover and tie it. And don't touch the front of the mask, and then adjust the mask in such a way it is snug on your mouth and nose. Today, and then while removing also, you remove from this one and then keep it like this. And if you want to reuse it, store it in a zip bag, or if you want to wash it, you take it for washing. Okay. And today, hand and mouth have become our private parts. Understand? Will we go out into the society without covering our private parts? Men and women, please answer that. Think about it. Will you go out into the society without covering your private parts? Is it civilized behavior? Same thing applies to mouth and nose. Okay, so we have to cover whenever we go out. And many people I see they keep the mask in such a way that they will put the mask somewhere here, hanging on the neck, or somewhere on the chin, and sometimes hanging on the ear like this. And there is no use. You have to properly wear the mask, and that is civilization. If we don't have civilized behavior, if we don't cover our private parts, we will be arrested. But here, which law can enforce you to wear a mask? Are there enough police people? Where you can put all these people? How much fine they will pay? It is self-discipline that has to come. Likewise, while removing the mask also, I showed you that you should not, what you should do, and don't open the mask in front of another person. And because whatever is there on the mask can spill onto the other person. There's another type of mask which is called the medical mask. So this is a medical mask is something which is not for routine public use. So this is somewhat like this. It is a green colored mask, and this is used only in cases of people when you are already a COVID patient, or when you are taking care of a COVID patient, or when you are in the hospital, when you visit the healthcare facility, or when you are a doctor or a nurse or somebody. It has got two surfaces, inner surface and outer surface. Never touch the center of the mask. There is a clip like this here, which is bendable, and then it can be adjusted to the nose. What you need to do is keep the mask with the threads there, tie it properly, and see that this one is there, and this also you tie it. And it should be snug on your face, and then it should cover both the nose and the mouth. Not simply keeping like that. I see many people keeping it on the chin, and I see some people keeping on the mouth as though they are breathing only through the mouth. Normally, we don't breathe to the mouth. We breathe to the nose. Again, while removing, hold it properly and dispose it. These are two essential things of how to wear the mask and how to dispose the mask. So these are the do nots also I have told you. This is the video. I am not going to play it because I have demonstrated. You can even see it's only hardly 1 minute. So medical masks are only for people who are health workers, people who are patients, and people who are so those who are taking care of the COVID people. But I showed you that. Whereas the other areas we have to use, whatever we need to use is, okay. And then other types, you use the fabric mask. This is a fabric mask. One can even stitch the fabric mask at home. For example, this is stitched by my madam. So she has got a beautiful cloth here, and she stitched it with the elastic. All the ladies in home, you can stitch up enough number of masks. Every day, whenever you go out, you use it, and then wash it with soap and water. Okay, this is about the mask. So understand this curve very importantly. This is what is called the epidemic curve. You see the beautiful color, the sort of ice cream color one. It is the epidemic curve when you do not do anything. Many people will get infected. Many people will have disease. Many people will get admitted into the hospital. We will not have enough beds, enough testing centers to do that. If that comes so suddenly in a month or two, what we try to do? We just try to reduce, delay the outbreak peak, and markedly reduce the outbreak peak, and then diminish the overall case and health impact, because then it is manageable by the healthcare system. So instead of ending in 2-3 months, it will take around 6 to 8 months. Let it take. But our healthcare system is not overwhelmed, and we have enough time to do the capacity building and treat, test, and then take care of people. So what are the measures we did? We did what is called the lockdown. All airports are closed, no travel, and complete restrictions. We want to ward off to start with. Once that is not possible, we use social distancing, all the precautions which I have now shown, like hand washing, and then your sort of mask wearing, all the things, sanitizers, all these things, whatever we have discussed are the measures to delay the peak and then flatten the peak. Here I have 3 words listed here. Epidemic means large number of people affected by a disease is epidemic in a short period of time. Pandemic means many countries affected is pandemic. Endemic means the virus or the bacterium will be there in a low level in the community, and that will be continuing. For example, tuberculosis is an endemic disease in our country. Right now we have an epidemic of COVID in our country. We have a pandemic in the world. That is why we are having this lecture. So you need to know also this one, what is called frequently taught as R0. What is R0? R0 means, so let's say the index cases are 1,000. That's the first level. Then they will infect 2,500 people, because 1,000 into 2.5 is that. And these 2,500 people, the second generation of cases, that is the third level, will be 2,500 into 2.5, which is equal to 6,250, and so on. It is an exponential without control measures. But then we do have control measures, and we want to bring the 2.5 R0 anywhere down towards 1. So there is what is called herd immunity. This also you may be hearing very frequently. Let us develop herd immunity, the COVID will go away. What is that herd immunity? It is calculated by the formula 100 multiplied by 1 minus 1 by R0. So let us have a whiteboard and then see. So 100 multiplied by 1 minus 1 by R0. Okay, in our case, the R0 is 2.5. So 1 by 2.5 is equal to 0.4, which is equal to, this one is equal to 0.6, multiplied by 100 is equal to 60% of the population need to be infected before we have what is called the herd immunity. It's a huge number, 40 crores of people, 60% of that is unimaginable number. So achieving herd immunity is not that easy. So let us say if the R0 is 1, what will happen? 100 multiplied by 1 minus 1 by 1. What is 1 by 1? 0. 1 by 1 is 0, multiplied by 100 is equal to 1. Yeah. 100% of the people are safe when the R0 is around 1 by 1. So that is how we have to calculate the R0. Our measures are to bring our R0 towards 1. Okay. And there is a nature experiment that happened. That experiment is here. You see here, we have the ship there, the Diamond Princess ship. In that there were 217 people who were there in the cruise ship. They were not on the land. Out of the 217, 128 people got positive, tested positive. Okay, and then looked at how many of these 128 people had symptoms of COVID? And 81% or 104, they were asymptomatic. That means they did not have any symptoms whatsoever. Means the asymptomatic illness is around 81% in that SHIP experiment, or roughly 1/5 are having symptoms in those who are positive for the disease, and 4/5 are not having symptoms. So what is this asymptomatic illness? Is that bad or good? Asymptomatic illness, is it good or bad? Think over. Asymptomatic illness is good in the sense it will be, a person will not know the disease, but he will be transmitting the disease, and by asymptomatic illness, you get the herd immunity. It is bad because it transmits the disease and then makes others contaminated. So we do not know in the community as yet what is the asymptomatic illness. Recently we published a study, ICMR has published a study, 20% of Delhi people who are tested there, 6,000 people, around 6,000 plus people are tested, and they have found seropositivity of 20%. What is seropositivity? People who did not have the disease but had the evidence of the disease, the antibodies are there. This tells me that we have to, there is an asymptomatic illness going on. There is also some amount of antibodies. This is an ICMR slide, Ministry of Health, Government of India slide, which again tells you if you have a person who is, if you have to, as far as possible, transact online, and if you have to go out as a must you have to go out, then use fabric mask like this, not the medical mask. Don't use the medical mask, nor the N5 mask. These are only for people who are in the hospital, who are taking care of the sick and all that. No N5 mask, no medical mask, only the fabric mask is required. It is reusable and washable. Social distancing is important. 2 meters or 7 feet. Carry a hand sanitizer, something like this. Carry a hand sanitizer with you, and then also some tissues with you also you carry. And then cough etiquette you observe when you go out. Do not spit. Avoid visit to healthcare as far as possible. Don't go to the hospital just like that because your friend is admitted, or you want to go along with some of your friend to escort him and things like that. These are not exhibition grounds. Hospitals are not museums or exhibition grounds. Lot of infection. In general also, don't go to the healthcare facility unless you have a reason to go. Clean all the purchased items with soap and water. Suppose they cannot clean with soap and water, like perishables, use warm salt water and soak them in warm salt water for 15 minutes, like your vegetables, fruits and other things. And milk packets also you wash with water, plain running water, and then sanitize the substances that you get. Rip open the packet and throw the packet and take the contents out and sanitize the content depending upon the type of this one. In general, keep the packet for at least 2 days in a separate place and without touching. Why? The COVID virus dies after 8 hours. So if you leave it for 1 to 2 days, it is very safe to touch the packet after that. Now, so these may look very simple. Whatever I am saying, these may look very simple and very repetitive in the media, and also in the phone. Also, you will be getting all the messages. Also, you will be getting. But then these are looking very simple and repetitive, but very important. In the absence of specific treatment, in the absence of a vaccination, these are the only tools for us. These are the only tools for us. That is why we need to follow these things. To stay ourselves uninfected, to keep our near and dear safe, and to delay the transmission, to win the war against COVID. And it is our social responsibility to take care of these things. These are everywhere you are seeing, but then we are not following. We are asked to wear helmets. We don't want to wear helmets. We are asked not to jump the red signals. We faithfully jump the red signal. What is all this? This is all uncivilized behavior. Likewise, we can't be uncivilized anymore with such an amount of the pandemic going on. And take care of the packets also. I have told you about that. If you have any doubts, specific questions, you can put in the question box. So what is it then? Once somebody is having symptoms, we have to test. ICMR has approved the test centers. There is a real-time updating of the test result and test facility, and list is available online in your local area, which is the test center. Then the question is, whom I wanted to test? All symptomatic, all those who are contacts of COVID patients, all those who are coming to hospital with respiratory symptoms, all healthcare workers who are taking care of COVID patients, and all those who have traveled and come out. Those who had a travel history into another country or another region with COVID, and those who are symptomatic, those who have confirmed contact with a confirmed case, those who are health workers, those who are having symptoms and admitted to the hospital, and health workers who are taking care of the sick people, particularly the COVID people, and those who are living in the same household as the index case. They must be tested. There is a limitation in the testing because sometimes testing facilities are overloaded. We have to find out, and then there is a newer test ICMR has approved. I will tell you about that. This is called the POC, point of care test. RT-PCR is the standard test to diagnose the COVID. Antibody tests are available for 500, 600. They are useless because antibodies will not tell you the current infection. They only tell who got infected some 15 days back. That is of no use. That is only for serological surveys, not for diagnosis. Report may take 24 hours. Consider any positive. Consider any person as positive until the results are given. Somebody has symptoms, given the test, waiting for the result, consider as positive. Know your COVID test center nearer to you. Know your COVID hospitals nearer to you. Private labs are also testing for the COVID. There is government is sending mobile vans to test for COVID, and some private labs are offering home testing. They will come home and pick up. What will be tested? Not the blood. It will be the throat swab and the nasal swab, and the nasal secretions, throat secretions will be tested. Okay, you have to understand this one also very clearly. What is this? So this is what is called the estimated incubation period curve. Usually it is 14 days. What is incubation period? The time during which the illness has not started, but the person is infectious. Usually it is 14 days. During this period, it is person is infectious, but disease may not start. That doesn't mean everybody will have the disease only at 14 days. The upper limit is 14 days, but the average time is 7 days. Within 7 days, the infectivity also will come down a lot, and the person also will have some evidence of infection there. Okay, now, these are the various types of people. People who are healthy, no symptoms. All of you are listening to this, you are in this category. There are other people who are asymptomatic, they don't have the symptoms, but they have a test positive. This is called asymptomatic illness. The third group of people have given the test, but the report is awaited. They are called pre-symptomatic. Then very mild illness called influenza-like illness, ILI. 80% of the people have mild illness, like any cold. Pneumonia is the effect of the COVID virus within the lungs. Hitherto it was on the nose and the throat in the ILI. It has spread onto the lungs. Then we call it as a pneumonia, which is nothing but infection, inflammation of the lung. This is around 15% of the people will end up in that. There will be severe illness with complications, 5%, and 1% will be dangerously ill or critically ill. This is the distribution. Healthy people, asymptomatic COVID test positive, pre-symptomatics waiting for the report. ILI, majority of us will be in this category and recover. An unfortunate few can become pneumonic, but doesn't matter. They will recover very easily within about 7 to 10 days. And when there is illness, severe illness, 5% will have complications. I will show you what they are, and 1% may have dangerously ill disease. Now again, what are the symptoms? Very common symptoms are, this is a CDC Atlanta Communicable Diseases Center all over the world. This is a reference center. And then fever, cough, and shortness of breath are the three most important symptoms. So what if the other symptoms occur? There are other symptoms also which can occur. Cough, sore throat, congestion and runny nose, and we have observed that loss of taste and smell is a peculiarity of COVID because it affects mostly the nasal mucous membrane, the taste and the smell particularly, and the throat also is affected, the taste also. shortness of breath, difficulty in breathing, or in severe cases, moderately severe cases. Fatigue, muscle ache, body aches, fever and chills may be there. Nausea and vomiting and diarrhea are in a few number of cases. How long the symptoms last? Symptoms take time to appear, around 2 to 14 days, and they last for about 7 to 10 days normally. At the worst, they're 14 days after the exposure to the virus. Now, the first question is, if you have a cold-like thing, the first question is, do you have fever? If you don't have fever, unlikely to be COVID. But if you don't have fever, do you have itchy eyes? Yes, then it is some allergic condition that is caused. If you don't have itchy eyes, you may have common cold, like sneezing, runny nose, and mild chest discomfort. The other way around, you have cough as well as fever also is there. Then are you experiencing shortness of breath? If you don't, normally fever, body pains can be any other flu-like illness, influenza season now, it could be influenza, cough, fatigue, weakness, exhaustion. Remember, symptoms of these are the same as symptoms of this because these are sister viruses. But here, the experiencing shortness of breath is one differentiating feature. But we do not wait till that develops. That is why we call the initial stage as ILI-like illness, influenza-like illness. In the milder cases, it will be like this only. Only when the pneumonia starts, then there will be shortness of breath. So the ILI is the common presentation. So now the government of India, Modi ji, has started this slogan, test, track and treat. So you have to test, optimal testing should be done, and track the contacts of the persons who are positive, their family contacts and other contacts, and treat all those as positive depending on the strategy of the treatment. So what is the test I use? Real-time PCR is the gold standard. And there are other tests called TrueNat and CBNat available. In some centers, they are very quick, same as RT-PCR in their efficacy. There is a new test which ICMR has approved 2 weeks ago. This is called the Standard Q COVID-19 Antigen Kit. Most of you might know a pregnancy test kit or a hepatitis test kit. It is like a small gadget in the hand, and it will be like a sort of this much size. And you put the nasal secretion with a dropper. There is a dropper there given, and then it will be positive. Within 15 minutes, we will know positive or negative. Okay, and this is very much available now in the country, but not really has percolated well. In a matter of time, this test will be available. This is a very good test to confirm their disease. Somebody is negative, what we have to do, we will see in the next slide. There are other types of tests called the antibody test. These antibody tests, somebody has put already a question. Here when they test for the antibodies, they test COVID antibodies only, not the general antibodies. But then these will appear after 15 days after you get the illness. What is the use of knowing that? By then you have infected yourself and you had the disease and you have spread it to others. So do not use the antibody test for diagnosis. They are only for zeros. We don't have an antibody test which will be positive or day 1 or day 2 or day 3. In the absence of such a test, antibody measurement is not a useful exercise, not for diagnosis. Okay, this rapid antigen test which I have showed you, the standard Q19 test is called the point of care test, also called the rapid test. So those who are raising the hands, please type your questions in the question box. We will take up at the end. We cannot take up any questions during the presentation. Now, this is to empower the public. No doctor's prescription are required. ICMR has approved it 15 days back. This takes 15 minutes. So if the RAT test is positive, rapid antigen test is positive, then it is a true positive and he will be treated as a positive for all practical purposes. Suppose it is negative, then we are not sure that he doesn't have the disease. Then we look at the symptoms. If he is asymptomatic, declare negative. If he is symptomatic with fever, cough, sore throat, then go for RT-PCR. The advantage of that is we don't have to go for RT-PCR, which is costlier, takes 24 hours, only labs can do. Only certain labs can do. Whereas this test, once it is available freely in the market, this is every one of us can really get the benefit of immediate testing and answer. So remember, if it is positive, it is a case. If it is negative, asymptomatic, negative. Symptomatic, do the RT-PCR. Now, Once we knew how to prevent, we knew about the virus, we knew about the preventive methods, we knew about the symptoms of the disease, we knew about the testing strategy, and now we are going to go into what will happen if somebody is positive. Okay, so test positive, are they eligible for home isolation? Who will decide? Healthcare worker or doctor will assess. Preference is for home isolation because we don't have enough beds in the hospitals. So preference is here. And who is the person who is going to be home isolated? Now, those who do not have any other diseases, those who are younger, less than 65, those whose oxygen saturation is good, those who do not have breathlessness, and of course they will be monitored. So if they have a ILI-like illness like influenza, 80% of people are here. If they're suitable, better to home isolate. Not suitable, admit to CCC. What is CCC? We will see. Supposing they are not eligible for home isolation because of these reasons here, then do they have a pneumonia? Then admit them to DCHC. What is DCHC? We will see in the next slide. If they are not eligible, they have a severe disease, admit them to dedicated hospital for COVID. This is a dedicated hospital, Cavid Care Hospital, DHC. Okay. Now, this is the triage, this one. So with this, we have to go now and see what are the different facilities. Somebody is tested positive or a suspect case. Then the first option is home isolation or the Cavid Care Centre, either government or private. Symptomatically mild, very mild disease, low risk patients, less than 60, no other diseases, 80% are here. And around 15% are here. This is called the Dedicated COVID Healthcare Centre, DCHC, Dedicated COVID Healthcare Centre. Symptomatically moderate disease, low risk patients, no other diseases, age is less than 60, but they have COVID pneumonia-like features. They are having shortness of breath and they have to be admitted to DCHC. Suppose somebody is really sick and breathless, who are having other diseases, who are 65 or 60 years plus, then we have to put them in dedicated COVID hospital. Now you go and find out from your resources, what is the dedicated COVID care center or DCHC in your area, get the contact number, get the person who is in charge of that, be ready and be prepared and write them down and somewhere. It is for you to understand what you do. Certain things I am showing here, what you have to do is, you have to have the pulse oximeter. The first one is pulse oximeter. It looks like this. The diagram also you can see, and I can insert my finger into that and it measures the sort of oxygen saturation. So I have put it on, and now, and then once you put it onto your finger, it will record the oxygen saturation and it will tell you the oxygen saturation. If the oxygen saturation is more than 94, there is no need to worry. If it is less than 90, there is immediate need. And then if it is, 94, 92, 93, then you see the symptom. This is what is called the second one, the digital thermometer. This is the infrared thermometer. You put it on, and then without touching the patient, you just put it to the forehead or the cheek or the chin, and then it will give the reading there. The third one is, of course, home BP apparatus you may be having. You have to look at the blood pressure. If there is a drop in blood pressure, it is an indication to go for less than 80 or less than 120 upper reading, less than 80 lower reading. You should be wary about it. And of course, people who are diabetic, check the sugar. What is this big instrument here? This is called oxygen concentrator. What does it do? It takes the room air and converts into 100% oxygen. What is the oxygen in the room air? 20% or 21%. This concentrates and gives 100% oxygen. This is a little expensive, around 50,000, but those of you who can afford to buy for your community, you can buy and keep one for emergency. Somebody is having low oxygen saturation. It will be very handy and useful before they could be properly placed in a hospital. So now I am triaging a patient who is positive. Okay, mild symptoms, somebody, either you or your family member, is positive. What to do? Mild symptoms, these are the symptoms here: cold, fever, sore throat, loss of smell, weakness. Serious symptoms like breathlessness, extreme exhaustion, altered sensorium. The one in the red, immediately hospitalized. If you are here, then what should I do? No panic. Record the temperature, respiratory rate, how many times is breathing per minute, and the oxygen saturation using the pulse oximeter. Okay, and if it is more than 94, no worry. And take paracetamol 2 to 3 times daily, 650 adult dose. Vitamin C 500 milligrams twice daily. You don't require a doctor's advice for this. And then take a COVID test in the nearest center. Either home testing or go to the fever clinic, they will take a COVID test. There are something in the gray. Don't worry about them. These are some medicines which the doctors will decide. As on date, the value of these medicines is coming down. Initially, we thought HCQS is very useful, the malaria drug, but we are now finding out that it is not very useful, particularly in the severe cases. In mild cases, it may be useful. Do you have any other ills like diabetes, hypertension, or is any other family member positive? Did you contact any COVID positive people? Did you attend a gathering? What is a gathering? Very common, the Upanayanams and then the Gruha Pravesams, then your marriages, religious functions, some sort of Satabhishekam, this Abhishekam. We have 101 reasons to have gatherings. We avoid all those things. Until COVID goes, no gathering at all. Don't get into gathering. And if you work in a healthcare, that is a very important information. Either as a paramedical or a nurse or a doctor or an attendant or whatever it is. Then you test, once you have tested, report will be available in 24 hours. If you are using the point of care, report will be available in 15 minutes. What do? Home isolation in a separate room. Whenever there is a facility to have a separate room, use this. Supposing there will be many people in the country who live in only one room, all of them, single room tenement or huts. In such people, they have to go to the government facility to isolate. Wear a medical mask and use the disposables for your purpose. Why medical mask? This is the medical mask. Okay? Why use that? Because you are already a patient. You could be a patient, test may become positive. Monitor symptoms 3 times a day, record the pulse, respiration, oxygen saturation, keep taking the medicine, watch for fever, watch for breathlessness, watch for oxygen saturation. No panic. We have not got the test report yet. Yes, now we have got the test report, tested positive. I have COVID. Don't worry. 80% of the people, they have normal illness. That is, they will recover. You will not be in the 20% who is going to be sick. No panic. Continue the advice. More fluids, nutritious food like fruits, vegetables. Contact your local hospital or government facility. You may need an isolation in the DCCR, DHCR, DCH, depending on the symptoms. Of course, you need home isolation. HI is home isolation, which I have already told you earlier. This is the triage. Okay. Now, what are the other diseases which can complicate COVID? High BP, extreme obesity, lung disease, heart disease, uncontrolled diabetes, cancers, chronic renal disease like kidney failure, immunocompromised conditions like AIDS or HIV, chronic liver disease, increasing age, smoking, and all these things are complicating illnesses. Means they are not causative illnesses. These can increase the difficulty for the patient. There is no direct cause that diabetes causes COVID or hypertension causes COVID. There is no cause and effect relationship. They are associations. One has to be very careful. The fatality may be more in such patients. These are observed as mere associations, no cause and effect relationship. Above all, the reaction of every individual is different. My reaction to an COVID or a bacterium will be different compared to yours or hers or theirs. So that is individual variations are there. There will be not like a computer program. Everybody will not get the same answer when you type the data there. Here, once the data, the virus goes in, how we react depends upon our system. This is biology. This is not maths or computer science. O group people from literature appear to have better outcomes. Inform your doctor about all these conditions if you have, because that will tell you how the doctor can tailor the treatment. Okay. Now, what are the complications? They are very rare and exceptions. What are the previous slide? These are the other comorbidities, other diseases, non-communicable diseases. These are complications a COVID person can develop. How many of them? Only 5% will develop. COVID pneumonia, there is what is called the excess chemicals or cytokine storm. There is a respiratory failure. The breathing fails as type 1 failure, we call it as. There is a clotting that is occurring within the blood vessels. Normally, blood should not clot within the blood vessels, but some sort of reason, the pathological reason in the body, the COVID stimulates clotting in the blood. The blood clots and doesn't circulate. Then there is no point in expecting the immediate recovery. You have to be treated very carefully. Pulmonary embolism is clot in the lungs itself. So we have to be careful. Sepsis, that is bacterial infection, severe bacterial infection, shock is follow blood pressure and then not able to circulate the blood properly, and then heart attack, stroke. These are all rare. They can get finally multi-organ failure cannot be. Remember, these are exception than rule. Comorbidities may be a factor, age may be a factor. People with this also will survive. I know my friend who has 3 comorbidities. He battled for 20 days. Yesterday he was discharged and he is very happy. So there are success stories also. Don't only read the negative news. Newer techniques are available. Mechanical ventilation is not for all. Don't think the moment you are moved to the hospital for COVID, a tube will be placed and you will be on a machine. That will be very rare condition. That will not happen. And we don't have that many ventilators to keep everybody on the ventilator also. Extracorporeal membrane oxygenator, it is the machine which does the lung function outside. The convalescent plasma, people who recovered, their plasma is used to treat. CyTORP is a new technique, very expensive technique, very useful for cytokine storm. It absorbs all the bad chemicals and CyTORP. It is available in some hospitals like Manipal Hospital here. And leukotriene inhibition, tocilizumab, a beautiful drug is available. And this could be a game changer. And there's another drug also, itoconazumab. That also is a very beautiful drug. And these are expensive, but only for a selected few and not accessible in all the cities as of now. Doctors may use blood thinners, steroids, antibiotics. Please accord your consent. Don't decide your treatment. If you are on the airplane with a ticket to go from here to Delhi, what you will do? You will choose the right airline and sit in the aircraft, put your seat belts and then relax. And you don't worry how the flight will be going, whether it will go in the through the clouds or above the clouds, whether the fellow is who is driving, the pilot G, he is able to drive properly, or whether he is trained, whether he will operate this switch or that gear. We are not worried. That is the job of the person who is piloting the airplane. Likewise, once we are in the hospital, the expert team will decide what is best for you. Every doctor strives his every nerve to see that the best is given. This is the way in which this is the spirit with which everyone is fighting, and don't be worried about that. Then you understand flu, the RO is 1.3 or not. Whereas in COVID it is 2 to 2.5. The incubation period in regular flu is 1 to 4. Here it is 1 to 14 days. Hospitalization there is less than 2%. Here it is 19%. 80% don't get hospitalized. Around 20% go to the hospital. There the mortality or the death rate is less, 0.1% or less. Here it is 1 to 3 or 3.4. In our country right now it is around 2.5. Okay. Now this is the comparison with the normal flu. Now you don't, the important thing about COVID is, if you don't invite me, I won't catch you. Do not read or view negative news. There will be some negative news coming up in the whole country. Read positive news. Do not depend on WhatsApp or other lay press. Check with the reliable websites. Do not forward unnecessary messages. Check with authentic source. Recovery is the rule for many. There is no need to be panicky. Do not think too much about severe illness and its implications right now. If we do that, what will happen? We will have to die everyday death. Death is only one time it can happen. If we start worrying, every moment we can die. Okay, that is very important to know that. Okay, Chita Chinta Tayor Madhye Chinta Eva Gariyasi. Chita Dahati Nirjeevam Chinta Dahati Jeevinam. Worry will kill the person right now before the death occurs. Okay, that is most important. Have a robust health insurance. There are top-ups available on your existing health insurance. These are covering for COVID up to 30-40 lakhs also. And then have that and have good financial planning. Sometimes the treatment may be as costly as 30, 40 lakhs also if you go to private hospital. In a rare case, I am telling. Now, what is the mortality like? Here, very young, no mortality. As the age goes beyond 59, 60 years, there is an escalation in the mortality. What does it mean? People in 80 plus, around 20% of people will die. Are people above 80 are not dying? Are they living for 200 years? Certainly the mortality will be more in people who are 70, 80, 90. The mortality will go up. This is the actual trend of mortality. So one is, don't have to be carried away by those things. This is the publication in the Lancet, very reputed journal. So reliable data are shown here. And then you see here on the other side, so there are in this particular study, 36,000 cases, mild cases, 6,000 severe cases, 2,000 critical cases, only 1,000 death. 1 in 36,000. 1,000 in 36,000 means 1 in 36. So imagine the rarest of the rare. Don't think about that. Don't imagine that in the mind right now. This again shows the mortality trends across the ages. You see in the earlier ages, there is no mortality. Once we are 50, 59, 1.3, 4.6, and the 9.8, around 18% above 80. Almost the same slide from a different data from China. Okay, how to set up a small isolation room? Some of my friends have set it up. Dolo you have, LIMS you have, zinc you have, ORS Tetra Packs you have, blood sugar meter I have not shown you. This is the blood sugar meter. So we can monitor the blood sugar here. In this meter, you know how to use the blood sugar meter. Then pulse oximeter I have shown you. Oxygen concentrator we talked about. Infrared thermometer we have talked about the infrared thermometer. BP monitor we talked about. And then gloves and PPE kit, sanitizers like the sanitizers, and then the liquid soap, and then 3-ply mask, because there is a patient we need to use the 3-ply mask and not the cloth mask. Tissue paper, disposables, and a covered bin to dispose of the things. This is the minimum facility you can keep it up. If you don't have oxygen concentrator, don't worry. If you can have it, it is better. Then breathing exercises are a must for all of us for generally good lung function, more so for the COVID. Normally, our lower backs are not well aerated because when we sleep, only the upper parts are aerated and the lower parts are not there. How do I improve the aeration? Sleep on the stomach, prone position, or sleep on the side, not sleep like a, like this, like a Rakshasa. Sleep on the side or sleep on the back. That ventilates the lung better. And when the patient is very sick, we now have a prone ventilation. You keep the patient in the prone position. My friend, I told you, battled for 20 days. He was on prone ventilation for 20 days in Chennai. So prone position is always better, if not side position. Do regular breathing exercises to prevent respiratory illnesses in general, COVID in particular. I'm going to show you a video for your clarity. Please view that, and that will be very useful for you, how to do the respiratory exercises. And also download Arogya Set app and Optomitra app. These are very handy. Nobody is going to put you in jail or they will not take you away once you have the app. These are very handy at the time of need, and a lot of information is available. This will tell you how many COVID cases are around in your area also.
Hi, I'm Jennifer Taylor, and as part of a series on wellness, I thought I might share a beginner's breathing technique with you that might help with stress relief and emotion regulation. You can do it with me now, or if you're experiencing any respiratory symptoms, you might like to just watch this time around. Either way, make sure you bookmark it and save it for later. So this one is called abdominal breathing or 3-dimensional breathing. So it can be helpful to place one hand on your chest and the other hand on your abdomen. And so to begin, we start by breathing into your abdomen, pushing it outwards on your inhale. Exhale, just allowing the abdomen to soften and fall away. Try that once more. Inhale, expanding the tummy. And exhale, soften and fall away. Now try adding the chest. Inhale, abdomen. And inhale, chest. Exhale, chest. Exhale, abdomen. Once more. Inhale, abdomen. Inhale, chest. Exhale, chest. Exhale, abdomen, beautiful, and relax. For the last part of this technique, add the side ribs. So it can be useful to take your hands and just gently place them on the side ribs. So we'll inhale abdomen, inhale chest, inhale side ribs, exhale ribs, chest, abdomen. One last time, inhale abdomen, inhale chest, inhale side ribs, and then exhale, 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 and release.
So there are certain myths, there are two types of things that she has demonstrated. One is the abdominal breathing, the other is the chest breathing. You practice them how many times? 5 abdominal breaths, 5 chest breaths, and once in the morning, once in the afternoon, once in the evening, once before going to bed. What is the difficulty in doing those exercises? They will help you to aerate your lungs and they will protect you from any COVID onslaught on your body. So exercising, you should not use masks. That's there. And shoes do not transmit. These are from WHO. All these myths and facts are from the WHO. Shoes are not going to transmit, but don't keep the shoes on your head, since we have said it is not going to transmit. But keep the shoes where they should be, but don't be too much worried about the footwear. You can always use a separate footwear at home compared to what when you go out. And then COVID is caused by a virus. There are several rumors circulating in WhatsApp that it is a bacterium or something and not a virus. Please don't heed your attention to that. Most people get the COVID, they recover. That is the most important thing that we need to understand. Some people say drinking alcohol, takat will be more and you will become very energetic and you could fight COVID. Forget about that. There are no studies. Don't use alcohol. It is harmful, particularly in high risk people. And then currently there are no COVID drugs licensed for the prevention of COVID. There are no preventive pills either in any system of medicine. Don't depend on any sort of claims that somebody makes. Somebody says, I will be heating myself to 25 degrees. I will go into the hot sun. I will not get cold. COVID. Very sort of wrong statement, a myth. Don't follow that. And again, being able to hold your breath does not mean your lungs are all right. Of course, you are able to hold the breath is good enough to do a breathing exercise, but that is not a test for COVID. Okay. And now ultraviolet light kills the COVID. No, it doesn't. Ultraviolet light, in fact, can harm your skin. Don't use that. And then coronavirus affect older people or younger people? Yes, it can affect all the types of people, as you can see here, but the older have got slightly higher risk. With all the things, now I am coming to the end of the presentation almost. Now, I have a few drugs listed here, of which we have what is called the fluopinavir is one drug which is found very useful, and this is what is called the EUA, Emergency Use Authentication. Though there are no big trials and data, we use certain drugs based on the evidence that we have. That is what we call as emergency use authentication. Flavipiravir is useful, and this is the mainstay of treatment in severe disease. Not in the first and second stage, not in the ILI, not in the pneumonia. Remdesivir is very expensive. Flavipiravir is not that expensive. Every patient who has got moderate and severe disease will be put on steroids, injectable, oral, as well as in inhaled steroids. ILI inhibitors, which are used in other diseases, are useful. More importantly, the IL-6 inhibitors, IL-1 is not that useful. IL-6, tocilizumab, itolizumab, these are new drugs which are available, but they're expensive. And then there are certain newer drugs that are there, but the data is still gathering. Remember, the information, medical and general information about COVID is very rapidly evolving. What I am talking today, or what you see in the publications of different things, will not hold good after 50 days as new things comes up. So how about the vaccines? There are 21 candidate vaccines are available in different phases of trials. 71 vaccines are in the preclinical stage, and then total 140 vaccines are being tried. As of now, no approved vaccine for public use. India is trying 2 vaccines, Covaxin and Zycov-D by Zydus. and these may be ready by the end of August, and from there it will take another 4 to 5 months to come for public use. So we are somewhere around 6 months or 9 months away from a good vaccine if these prove good enough. Likewise, there are 3 other candidate vaccines in the world. In AstraZeneca vaccine, the United States vaccine, they are also, and the Russian vaccine, these are also in a very advanced stage of trial. There is a strong light of hope, provided the virus does not mutate. And it, as of now, it is not mutating very fast. So we can think of a good vaccine in the time to come. Now, how do I live with COVID? This is almost the last slide. Okay, I'm coming nearer here. Relaxation exercises, yoga, meditation, aerobic exercises, breathing exercises, prayer, creative activities, positive thinking, installation of hope in others, particularly those who are tested positive, reading whatever you have to read, good material, and you have to catch up whatever material you wanted to read. This is the time to catch up. And then music, online learning courses, either philosophical, spiritual, vocational, or hobbies, or whatever courses. If one wants to learn about gardening, learn online courses. One wants to do exercises, go online. One wants to know knitting or baking, you do that. Or one wants to learn Brihadaranyaka, you go and learn from your teacher, Brihadaranyaka. Indoor play activity. So these are the various ways. Indoor plays, playing with the kids, grandchildren, having the family union every day at 1 or 2 hours, relaxation exercises, yoga, aerobic exercises, breathing exercises, prayer, creative activities, positive thinking, installation of hope, reading good material, music before you sleep, soft music, not the one which damages your heart and ears. You listen to soft music, whichever you like, old cine music, or if you are fond of Carnatic music. Online learning and indoor play are the best methods to cope. What are the lessons we learned from COVID? There are 5 or 6 lessons we learned from COVID. What are the 7 lessons we have learned? Home is the safest. Okay? That we learned that home is the safest place. Earlier we thought we'll be safe going out somewhere, but then can be productive from home also. This has been proved for every one of us. Equality before COVID, like before God, there is Sarva Manava, Sarva Mata, Samanatva. Whichever scripture you read, it teaches you of Samatva, and COVID has taught you Samatva. Okay, we can live without our luxuries we learned. We have not purchased our fancy luxury watches, luxury items, luxury jewelries, no gold for sort of this Varalakshmi Vratam, or no festival, no birthday gift, nothing. We have avoided those things, and we are still happy without luxuries. Understand, this is the way we need to live in future too. Avoid wasteful travel. We haven't traveled anywhere, saved a lot of money, trouble and pain to others whomever we visit. They are pained by our visits also. Today online resources are there. Come online, talk to them, enjoy the friendship, have fun, but avoid wasteful travel. It taught us a civilized behavior, how to cover my cough, how to cover my face and nose as like a private part, how to sanitize my hands. All these things, as we taught. And we have less pollution and less disease today. You see, there were reports saying that from Jaipur or Ajmer, they were able to view the Himalayas around 200-300 kilometers away today because the air has become so pure, which was the case around 200 years back. These are the lessons learned. And finally, stay safe, stay healthy, and stay at home. And don't forget these people, the paramedicals, the assistants, the nurses, the ward boys, the scavengers, the attenders, the ambulance drivers, the police people, the security, the persons who are bringing food to your hand. Everybody is fighting tooth and nail to fight COVID. And of course, the central figure is the doctor. Here is a time to regard all these people as our saviors, as our gods. And we thank all the COVID warriors with all your heart. You submit your good wishes to them. See that they are safe and then they are happy because they are taking a very heavy risk and doing a great service. Most important news is it won't be like this forever. Remember, it won't be like this forever. There is a Saptapadi, or the 7 steps for COVID. Saptapadi is 7 steps. We do it in our marriages. Likewise, there is a Saptapadi here. What is that Saptapadi? Let us see. For COVID, if you don't catch me, I will not catch you. If you don't catch me, I will not catch you. Test, trace, and treat, and train. Recovery is the rule. Serious disease is an exception. Panic and fear, they take us nowhere. Ma Sucha. Even in such a big Kurukshetra war, he was advised not to become panicky. So there is no point by being panicky. Avoid negative behavior, negative chat, negative news. Preparedness and acting right is our civilized responsibility. We are civilized people. We have to behave in a civilized manner. Stay home, stay safe, stay healthy, and be a socially responsible citizen, and spread this message across. Share this video, share this news, share this PPT to everyone. Believe me, even this will change. And we have a wonderful tool in us, which is the faith on Almighty and the prayer. With that, we will end today's talk, and I will take the questions from this one. And the best way to greet everyone is by Namaskar, and not by handshake or hugging. Namaskar is the best way to say a bit to COVID. With this, I am ending my sharing of the slides, and I am back to you to take questions.
Thank you, Dr. Sharma. Thank you all for sending appreciation notes through chat. We'll take the Q&A now. We have around 10 questions, Doctor. We'll start with the ones that are not directly answered. So what is the difference between a fabric mask and a medical mask? And there was also a question about N95 masks. Which shall be used?
I told you already, this question has been answered very thoroughly. This is a fabric mask. Inside will be white color and outside any color you can have. The fabric mask to be worn by all public. Whenever you go out for shopping, to your walking area, or to meet anybody downstairs, you use the fabric mask. You are not a patient. If you are not a patient, if you are not a COVID positive person, if you are not symptomatic, fabric mask is the one to be used. Not the best, it is the one to be used, not the this one. The other mask is the medical mask. This is for healthcare people who are in the healthcare facility, who are taking care of the outpatients, who are receiving the patients, the reception clerks, and all the people, and also those who are already having cough, cold, and who have symptoms who are tested positive. This is also used by your cashiers and also your people who are serving you at the counters. They have to use a fabric mask. Why fabric mask? These are not disposable, these are sterilizable, and these are reusable. Whereas these are not sterilizable, these are one-time use and you have to dispose. And then N95 mask and a respirator masks are not at all our purview. General public would not use N95 masks. N95 masks are scarce in quantity, they are very expensive, and they are not for routine use. They are only used when aerosols are generated in the hospital, when somebody is being taken care of. N95 use. Don't use the N95 at all.
Thank you, Doctor. A couple of questions on the tests you have mentioned. Can you explain a little bit more about the 2 broad tests? You have actually detailed it. Probably this question was typed before you explained all the tests. Can you please summarize about the 2 tests that you have highlighted in all your presentations?
There is a way of detecting the virus. I have shown you the beautiful color diagram. It has got the proteins outside. Each test will go and try to pick up the protein on the outer core. The test that is used is what is called the COVID, the RT-PCR test. RT-PCR is the test that we will use, and this RT-PCR is the gold standard test. It is around 2,000, 3,000 rupees privately, and government is doing free of cost, and it takes, the report takes around 24 hours. Anybody cannot test it. Only the recognized government labs by the ICMR, they can only test that. Whereas ICMR has recently approved another test called the POC test, or the point of care test. This is like a card test, like a pregnancy test or a hepatitis test. You would have seen a little card-like thing. You put the material, infected material. If you get 2 lines, it is positive. 1 line means it is negative. Control line will be positive. And if none of the lines are there, test is invalid. So what will happen? If I get the test done, it will take 15 minutes to know the result. And if it is positive, confirms COVID. If it is negative, then am I asymptomatic or am I symptomatic? Do I have cough, cold, fever, breathlessness? Yes, then go for RT-PCR. I don't have any symptoms and the routine POC care is negative, test is negative, then we are rest assured, call them as negative. This is what ICMR has given. There is a document available on the ICMR website. One can download and read further if you want to know about the POC test and the RT-PCR test. But do not ask for or do not heed your sort of mind to the antibody test. Why? Antibodies are positive only after 14 days and you don't know the current infection. And antibody tests are 500-600, they will be offering. That is of no use. Only thing is, it can tell you whether you had COVID. People who had COVID, they will be antibody positive. And for example, in HIV, we use an antibody test because the antibody is positive right immediately. And we don't have such a test now. If that were to be available in the near future, a right immediately available 1 to 2 days antibody test, which will be very useful. For example, dengue fever, we have a beautiful antibody test which is positive on the 3rd or the 4th day itself. So that is not the case with COVID. We can't have an antibody test right now because there is no immediately positive antibody test. And we test the antibody, we not only test for COVID antibody, we test we don't not test for the general antibodies, we specifically only test for the COVID antibody.
Thank you, Doctor. I think multiple questions got answered. There are a bunch of questions on the need for a chest X-ray and CT scan to confirm the disease. Whether X-ray is enough.
What happens is when you do an RT-PCR, sometimes in a small proportion of people, its sensitivity is 95 to 98% depending on the sample. If the proper sample is not given, RT-PCR may be negative, but the person will have breathlessness, cough. In such a case, we do a CT. CT scan or MRI as a routine is contraindicated by health sciences. Nowhere it is given as a first test to do. They will be offering, come and have a CT, 5,000 rupees to give. Don't heed to that. Only first test is RT-PCR or POC care test. If that is not positive and they still have a symptom, then you have a reason to look at the CT or MRI, not on a routine.
Thank you, Doctor. The next one, could you please give the precautions to be taken, especially for people with comorbidities like diabetes or above, in general, above 60 years need not have comorbidities?
These are called non-communicable diseases, NCD. Other non-communicable diseases also called comorbidities. Morbidity is disease, comorbidity, co-diseases, which they already are having. Majority of the people, they may have diabetes, hypertension, or some lung problems, they are smoker, something like that. The risk for them with COVID infection is higher. What does that tell me? That tells me that they should be all the more careful to prevent themselves in the first instance. And people who are above 65, don't go out. Let the youngsters go and get it for you with the mask. And you don't venture to go out when you are aged, particularly above 70s. The many hospitals, many organizations, they have stopped keeping the people who are elderly to come there. So this is the special precaution. And nonetheless, please be advised, if your diabetes is under control, blood pressure is under control, if your other morbidities are already being taken care of, consume those medicines, be rest assured that you will not get a fatal outcome. And hope for the and prepare for the worst.
Thank you, Doctor. And there is a general question on patients who are positive and after they get treatment and they get discharged without even checking the RT-PCR results. So what is the risk of doing that, discharging people early? Obviously, it's a supply of beds and the issue around that. It's a larger point the participant is asking.
As I told you, RT-PCR is the test, and its ability to pick up disease is around 95%. And 5% of the people, it may not pick up the disease. If we send them into the community, there is a small risk. What we are doing, even if the RT-PCR is negative, you keep yourself under home isolation because you have symptoms, and then come back for a test after 3 or 4 days. That's what we do. If they can afford the sort of retest, and then better thing is keep them under home isolation and monitor the symptoms. The symptoms worsen, of course, the CT and other things we do, and bring them to the healthcare facility, either DCHC or DCH, depending on the severity of the disease.
Thank you, Doctor. What I know, there is a very specific question from Dr. Subbaraidu. What are the drugs to be discontinued in CTD? You know, this is a very specific question.
This question, I am not going to field it now for the reason because these are general public. Dr. Subbarao is requested to contact my number. My mobile number is already given. Please type it in the chat box. Dr. Subbarao will be able to contact me one-to-one basis. And here we are not learning how to fly the airplane. We are only learning how to sit safe in the airplane. So for people who have to drive the airplane or the pilot the airplane, the things are different. I would discuss with the doctor, too glad to discuss. And I also advise you to look at a similar presentation, which is there on my website on the YouTube channel around 15 days ago for doctors I have given. That would answer some of your questions. If not, kindly, doctor, please get in touch with me.
Okay, there are a lot of questions from Geetham online classroom, but I'll just cover a couple of them. There are a lot of statements and questions to be very specific. So one of them is, there is an app that is circulating these days as a viral WhatsApp message. Is it the right app for measuring oxygen saturation using a fingerprint or not?
Absolutely not. Don't use them. These apps have a sensitivity of around 60%, and the specificity also is around 50-60%, which means it may not be useful when it is showing good result. It may not be useful when it is showing bad result. So better you buy a standard thing, a digital thermometer and a glucose monitor for this and a pulse oximeter separately. And don't use those apps. There is a lot of variation that occurs when you use the mobile-based apps for measuring your oxygen saturation, heart rate, and things like that. Please don't do that.
Thank you, Doctor. We are at the top of the hour, so I'll take the last question remaining. We'll answer offline. The last question is mainly around testing asymptomatic contacts and government not doing enough. I think there are a lot of comments and concerns around that. So what's your view on that? It's a very broad topic.
India is a large country. We have 140 crore population. If the test were to cost me, let us say 1,000 rupees, my GDP is not adequate to test all the 140 crores. Our GDP will not be adequate to test all the 40 crores. Then what do? I have to screen and then only test those who have the probability of disease. By doing the test, we have to filter the people with probability of disease being more. Who are they? People who have symptoms, people who are contacts of COVID positive patients, people who are health workers, people who have traveled from a country where COVID is very high or a region where COVID is very high, and people who are aged and then immunologically compromised with milder symptoms. You target them so the capacity building that is available will be able to do. Nonetheless, private labs are open. 30% of the labs approved by the government of India are private labs. For a cost, they will do it. They will come to your home and also do it. If you can afford, tests are available in the private. In the government sector, I understand there could be a constraint to the number of tests that they can do. That is why to overcome that only, the point of care test has been approved in several countries, including government of India, 15 days back. If that is available, it makes life easier for all of us to get tested.
Thank you, Doctor. We'll end with the last question. You have suggested good food, good thinking, good habits. Are there any immunity boosters for all age groups? This is a general question from one of the participants.
What is the immunity booster?
Yeah, what are the immunity boosters in general you would recommend?
The faces that you and I are keeping, the smiling faces, is the biggest immunity booster. Because if you learn how to smile, and how to live happily. That is the biggest booster of your endorphins. Endorphins are chemicals in the body. If you get raged, if you get angry, if you are jealous, if you are introvert, if you are depressed, the endorphins will go down and put you down. This is what exactly is Sarma, Dhamma, Uparati, Titiksha, Samadhana, whatever you are learning in your spirituality. Simply speaking, live a simple, uncomplicated life. Don't heed to negative things. Don't be the kama, krodha, lobha, moha, mada, matsaryas. You bring them, put them away, and keep smiling. And of course, nutrition is essential. Fruits, vegetables, milk, and then all these things in good quantities. And if you are having age, please supplement yourself with vitamins, general B complex vitamin, and vitamin C will be very useful. Other than that, there are no specific immune boosters for COVID. Regular exercise is a great immune booster, great moral booster, psych booster, and immune booster. Breathing exercises, all of you from today, start doing the breathing exercises, not for COVID's sake, for the sake of your health. And whatever behaviors we are adopting now, we have to continue them whether COVID subsides or not. That is the only way India can become a better, healthy country.
Thank you, Doctor. Thank you very much for an enlightening and engaging session. I now request the co-panelist, Dr. Goti Ravi Prakash, sir, to say a few words, a note of thanks, and finally we shall end the session with a prayer. Thank you, Doctor.
Sure.
Thank you,
Sudhir, thank you. A very wonderful educative session by Dr. Sharma Garu. But first and foremost, a sincere appreciation to all those who have attended this web-based seminar. If not for them, there is no meaning in having these seminars. We express sincere gratitude to the officials of Micro Labs for extending their webinar facility. I also would thank Sri S.V. Ramurthy Garu and Sudhir Durchati, who have done an excellent job as panelists. Last but not the least, a big thank you to Dr. Sharma Rajkunda for taking time out of his busy schedules. I know how busy he is every day, every week, to prepare meticulously so many details and to educate all of us for over 1.5 hours. A big, sincere thank you, Dr. Sharma Garu. Please say the prayer.
Yeah, it is a very good session. Thanks to one and all. And as Dr. Sarma detailed that prayers is the best immunizing factor. So let us close the session with a universal prayer, wishing all for good for the entire humanity at large. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pasyantu, ma kaschid dukha bhavnavet. Om Shanti Shanti Shanti. Thank you all.